So let's go through and do a review of heart failure for the physical therapist. This is, again, meant to be a review. You've already had some lectures and materials on diagnosis and medical management of heart failure. This is meant to hit the highlights for you. So what heart failure is, as you see, it's a syndrome. A variety of different things, a variety of events that have taken place that leads to impaired oxygen and, or more appropriately maybe, pumping of blood. It could be the body's no longer able to pump the blood, or the heart's no longer able to receive the blood in the chamber in order to pump it. Typically, this is something that's been going on for a long time. The body's no longer able to compensate. And while we call it heart failure, and that's true, and that's the main thing, other systems are affected too. And we'll talk about those other systems later on. But as you can guess, pulmonary, musculoskeletal, endocrine system, all these systems are involved. Just to be familiar with the classification system, the New York Heart Association, this is one of the most common ones used. And where is ejection fraction on this scale? Well, of course, the answer is it's not there at all. This is really based on symptoms. So the different classes are based on symptoms. So, slight limitations with physical activity or unable to gauge in physical activity. The symptoms are what really classify the heart disease. I always like this because the idea of a glacier, that what you see on the top is only part of the iceberg or the glacier. What below, there's all this stuff going below. So as a physical therapist, what do we see? Well, we see the edema, we see the shortness of breath, the tiredness, the difficulty breathing when they're laying supine. But what's causing it? What's going on? Well, changes in the heart are going on, fibrosis, the heart's on pressure overload and volume overload. There's vasoconstriction throughout. There's all these hormones being released, which are affecting the heart. So there's all these things going on below the surface, which are really impacting all these things that we see as a physical therapist. Causes, just like any other cardiovascular disease, it's risk factors that might cause it. So the aging process, hypertension, other things though too. Previous heart attacks, infections can lead to it. Pulmonary disease can actually trigger heart failure that way too. So typically it's lifestyle, typically it's risk factors, already having heart disease, and then the heart goes into failure afterwards. Earlier we talked about some of the complications that may be present with heart failure, or I should say compensations that might be present with heart failure. So the body uses these 5 compensations to allow the person to function normally. It's when these compensations no longer work, that's when we have the symptoms of heart failure, and that's typically when someone might seek out services, medical services, or even physical therapy services. I will point out the Starling principle. Remember, that's when the heart's stretched, there's extra volume in the heart, allows for more forceful contraction. The muscle can hypertrophy, which is a good thing typically. But the problem with this is that there's hypertrophy, but there's not always the vessel growth to go along with it. So more muscles, but the same amount of oxygen being delivered. Retention of fluids. The body retains fluids because if there's more fluids, there's more carrying capacity. But think about extra stress in the heart. Sympathetic system. You get that trigger to pump more forcefully, and that, again, can be a good thing, but after time it wears down the heart, and we don't have that reserve to be able to kick in later. And then blood pressure goes up. Helps with improved delivery, but it's more work on the heart to pump when you have increased blood pressure. And this is the cycle you might get into. You have dysfunction, and then it leads to decreased output. The compensations take place. Cardiac output goes up, but then the workload goes up, and it leads to further dysfunctions, which then continues the cycle as we go. Just to mention all these other systems that can be involved, from the heart, the lungs, renal system, musculoskeletal. I always mention nutrition because if it's difficult to breathe or you fatigue, actually eating can be a very strenuous activity. We can break down heart failure in left-sided versus right-sided heart failure. Now, typically if someone has heart failure, both sides are affected, but you might see one side affected more than another. With left-sided heart failure, it's more of an issue of dyspnea of exertion. You see some hemoptysis, because think about the plumbing of the heart and the lungs. If the left side's not working well, it backs things up in the lungs. So that's why you see crackles or pulmonary edema, pleural effusion. The lungs are more affected with left-sided heart failure because of the lungs being in series with the left side of the heart. If the left side fails, it backs up in the lungs. More right side, we think about more the venous system being affected. Because the right side fails, it affects venous return. So abdominal pain, inability to eat, or anorexia because of discomfort associated with eating, bloating, swelling. These are the patients who are going to have their jugular vein distended. They're going to have very swollen feet. Their liver is actually going to be swollen because of this blockage or this insufficiencies in the right side of the heart. You can also have systolic versus diastolic. During systolic, this is what I think we tend to mostly think about, a problem with actually pumping the blood out. The heart's weak, it's dilated, it's changed shape, you have problems with pumping. But with diastolic, what happens is there's more of a fibrosis that has taken place, or a hardening of the heart, which then limits the ability of the heart to accept blood. So the heart pumps just fine, but the amount of blood in the heart is decreased. Treatments, medications, lifestyle, surgery are the big ones. Let's look at some of the medications. These are common categories. You might see a diuretic to get rid of some of that volume, ACE inhibitors, beta blockers, anticoagulants if the person has pooling of blood. The one that's a little bit unique to heart failure is the digitalis, or the digoxin. This is used to increase the forcefulness of contraction of the cardiac muscle. It is one of those medications that can have side effects and cause more arrhythmias if it's not done correctly. So this is a medication that a patient might have some blood work on afterwards to make sure the proper levels are reached. Lifestyle modifications, any big surprises here? Proper diet, low sodium, monitor weight, exercise. The weight is really important for this population. 2 or 3 increase in the weight per day is a concern. So if all of a sudden the person adds 2 or 3 pounds in their weight over just one day and there's no explanation for it, what the explanation might be is that they're going into heart failure and they're retaining fluid. So it's important they weigh themselves every day. Cardiac rehab is now reimbursable for patients with heart failure. So that's a great place to go to get supervised exercise, education, and learn how to address the symptoms of heart failure. Surgery, I'm not going to go through all these different techniques. You'll get these at different times. We've had some of these already. But surgery can be used to treat the patient who has heart failure, to really manage the heart itself. And the ultimate would be actually the heart transplant. But very few people get the heart transplant because of a shortage of donors. So that gives you a summary of heart failure, and hopefully you can take this information and apply it when we get into cardiopulmonary therapeutics this semester.